Hello there. My name is Ruben Rucoba. I'm the medical director of Pediatric and your moderator for tonight's live Q&A session, How to Talk to Children and Teens About Traumatic Events. The horrible events of last week's shootings during the 4th of July parade in Highland Park have brought this topic to the kitchen table of many of our families. And we want to do our part to help you and your children as you process these events. Joining me on the panel tonight will be Dr. Shauna Freedman, psychologist and doctor of psychology, who sees patients at Pediatric Partners in Vernon Hills and Highland Park. Dr. Denise Gardner, Ph.D., a psychologist who sees patients at Elm Street Pediatrics in Winnetka, and both of them will see patients from other Pediatric sites through telehealth. Also joining us on the panel, Dr. Susan Sirota and Dr. Laurie Hochberg, two of the founding members of Pediatric Partners, whose office on the parade route in Highland Park sustained damage from bullets in last week's shooting. We have questions that have come in over the last week from you registrants, and we'll get to as many of those as possible. You also tonight have the ability to send in questions live, either through the chat function on the Zoom call or through Facebook Live. Don't worry if you missed something during the session tonight. We are recording this, and over the next few days, we'll be sending out a link to everyone who registered for this event, telling you how to access that recording. And it will also be available on the Pediatrics website later on in the week. We want to respect everyone's time, so we're going to try and end this session promptly around 8 o'clock. Many questions over the last week have dealt with how and what to tell children at different ages. So let's start with a brief description of how best to present the information to 4 different age groups. First, let's start with Dr. Freedman. What do you tell preschoolers who hear about this or were there and saw some of what happened?
Thank you. So 2 different things. So if your child was not there and they're under the age of 5, we don't really recommend sharing it with them at this point. If you feel like they're going to be in a situation where they may learn it, then it's okay to, but if they're not going to be, it's okay not to share that information at this point. If you do talk about it with them, keep it really simple, less than 2 sentences, keep it just very brief and honest, just that, something, a bad guy came and hurt some people, but heroes came in to help a lot of the people that were there. You want to end it on like a positive note so that they can take that away with them. If they ask questions and you don't know the answer, it's okay to say, I don't know. What kids at this age really need most is just someone they trust, just to listen and accept their feelings and be there for them. You don't worry about knowing exactly the right thing to say. There is no perfect answer that's going to make it okay. If your child was there, they're probably just going to have more questions. And so it's okay to answer any questions that they have. Again, just keep it really simple and brief. Be honest, don't lie, because that will break any kind of trust, but just keep it really child-friendly and really simple. Follow any conversations about what happened with a favorite story or a family activity, just to help kids feel more safe and calm. And when you are talking with your preschooler, do your best to use a calm voice, again, simple language, just because they're looking to you to feel safe. And so how you act and your behavior towards them is going to make them feel that way.
Thank you, Dr. Freedman. Next up is Dr. Gardner. What about those kids who are a little bit older, maybe the early school age children?
Absolutely, thank you. So I'm going to be speaking on talking to kids around the age range of 6 to 10. So especially on the younger end of that, I would agree with what Dr. Freedman said regarding keeping the explanations simple and very basic, and making sure that the language you're using is child appropriate. I would say in terms of the level of detail or words that you're choosing, be sure to avoid using any extra words or details that may create additional fear for the child. Kids that are on the older end of that age range may be more likely to have more questions or ask about more details. And again, it's okay to provide information and answer their questions as best as you can. And then similarly as to what Dr. Freedman said for the younger age group, continuing to remind them of people that are helping keep them safe and resources that are available to continue keeping them safe.
Thank you. Next, Dr. Sirota, what about those middle school children and tweens?
So this is a little bit of a maybe trickier age in that there's really a wide range of maturity and understanding sometimes developmentally in this time. So as a parent, I think the first thing to do is just understand your child's level of maturity, their understanding, and also keep in mind their temperament. And I think that can get you on your way. I also think it's a good idea maybe just kind of think through, process your own response first and figure out the message you want to convey or where you might want the conversation to go. So it's, you know, I think through all of this, we talk about parents need to think about themselves too and take care of themselves first. It's like putting on your oxygen mask first, right? And so I also think we should keep in mind that this is an age where these kids have phones in our community, and they may have been there, they may not have been there. All of them, and probably very likely, have seen images in the media on their phones, even before parents might realize they saw them. And these images will stick with them. So especially now, I think it's important to perhaps monitor more closely and really try to limit exposure to some of this. When we think about this age group, though, we really think about the importance of giving them clear, consistent education. That's always really important at this stage of development. And then how much is really the amount I think that's needed to give the education that your child is seeking. And that's really going to relate to where they are developmentally. It's important, as was already said, to answer questions honestly. And a good way to do that, especially you know, for kids who are there because of what memories they may or may not have, but for kids who are not there, start by asking them what they know and be sure to correct any misinformation. You really need to be a careful listener so that you can follow your child's lead. And really, I would recommend not providing any more information than what they want or what they need. So that's where listening is really key. And as was said earlier, I want to continue to emphasize this, that it's okay to say we don't know. And I know a psychologist who I've learned from has referred to this as the I don't know zone. And this is something that you can actually create in your family, and you can talk about questions, just go in that place. And this also helps your children learn at a kind of tween and sometimes challenging time that we don't have the answers to all the questions that they might have. And it's okay not to have all the answers. So it's important to listen to feelings. This is a stage of development where kids start to experience a whole range or host of feelings and emotions. And we have to allow them to have the behavioral and emotional responses that go with these feelings. And some of these might be very big or very uncomfortable, but again, to let them know it's okay. So we start by asking how they feel about what's going on, what they experienced. Open-ended questions help you hear the most about what your child has to say. And I think through doing this, we can model for kids at this age that it's okay to talk about hard things, that it's important to, and it's okay to do that. So we validate their feelings, including the big feelings, as I said. And I think it's also okay as parents with this age group to acknowledge our own feelings, but to be sure we're using age appropriate language for their stage of development and doing it in an age appropriate way. And then kids are going to need breaks from this. You know, this is going to be lots of little small pieces of conversation not necessarily a long conversation, and plan for that and be aware of it, and listen for your child's cues that they've sort of had enough of a piece of a conversation. So I want to just like really quickly, some very specific things that I think might help with this age group. One, of course, is really show positive images of the heroes and those who were helping and those who continue to help in the community, because this can, to a certain extent, counteract some of those negative images that we know this age group has really been exposed to. And then when you have conversations about it, you can direct the conversation in a way where the focus can be more about your family beliefs, your family values, as opposed to a review and an ongoing review of some of the frightening details and the violence. We can help them by talking to them also about efforts in the community that are coming about to support safety in our community. And then, of course, it's really important to help them find ways to manage their feelings. So these might be kids at an age that they're more independent, they're going out on their own to play, but doing things like being active together, maybe going for walks, bike rides, shooting baskets outside, engaging in an art project, if that's something your child likes to do, gardening, if that's something that your family's into, and even encouraging journaling, because writing is something that can be very helpful at this age. So, and then I think for those who are particularly mature, Dr. Hochberg is going to talk about adolescence, but some of these tweens might want to look for solutions, and that's something you can help them with as well.
Thank you. And as Dr. Sirota mentioned, we're going to go to Dr. Hochberg now. What do we say to teenagers?
So I just want to first start out by kind of reassuring our community that we, Highland Park and our neighboring suburbs, we are a very strong community, and our kids are going to do fine. And we're going to do fine because we are a strong community and we take care of each other. So I think we've seen that in the last few days, that the outpouring of support and everything for everybody is going to help build us up and help us get better. And it's going to help our kids as well. That being said, everyone is different in how they react, initially. Teens can be overly expressive, or they can completely shut down, as I'm sure many of you with shut doors in your face have noticed at your houses. Adolescence is a time of transition and growth, being exposed to the world on a larger scale. Teens are trying to mature into adults, but trauma can make them feel like children. So the teen brain circuitry gets really kind of freaked out at this, and the emotional regulation really gets out of whack. So there can be some very extreme emotions that you're going to notice, as well as some decrease in their overall functioning as they're trying to process this. So teen trauma can take many forms. Some kids have intense fear and trepidation. They feel like something bad is going to happen again and again, and they may have flashbacks. Our brain holds memories so we don't forget a trauma. So things like smell, sound, or a feeling can evoke a flashback or a feeling that something is going to happen again, and this can be really scary. There also can be a lot of worry and anxiety. They may get overwhelmed in daily situations which didn't overwhelm them before. And it can feel kind of paralyzing. So they may just really shut down. They may also be kind of on the edge all the time. So you may notice they're very irritable. And this may also look like anger or frustration. Some also have complete avoidance. They avoid people, places, and especially reminders of the event. There can also be quite a bit of rage and angry outbursts. This can result in some increase in impulsivity and risk-taking, which can be especially dangerous. So being careful with cars at this time, psychologists recommend not making any major life decisions when you're stressed out, but that also, for teenagers, that could be making a good decision about going to a party where there could be substances that they don't normally try, or getting involved in a sexual encounter that they shouldn't be doing either, that they normally wouldn't do if they weren't under this type of stress. So kind of keeping an extra eye on your teen and just explaining that you're just really just concerned about their safety at this time. There can also be some overwhelming shame and guilt. Some teens blame themselves for what happened to the people. They wish they could have change the outcome. They think about what happened before, during, and after, how, if they had been in a certain place, how could it have been different? And really just we need to reassure them that none of this was their fault. There can be a lot of grief and depression, as a lot of us are feeling. And again, this is very normal, and hopefully will pass in the coming weeks. Some feel very numb, or try to feel nothing at all. They withdrawal and isolation is a coping mechanism to avoid feeling immense sadness. So some teenagers may just really kind of zone out and not engage. They also may not sleep well. And we know teens don't sleep well on a good day. We know social media keeps them up at night. Social media obsession about this event is going to even further worsen their sleep habits. So really encouraging your teenager to turn off, try to get some rest, because if they're tired, their emotions are going to be even more extreme. We really just want them to feel good. Now, some people are afraid to sleep because they have such bad nightmares. If these continue, certainly we would want to get some help for that. Teenagers also, as well as younger kids, can also have some somatic forms or feel bodily changes when they're upset. And this can come in the form of like racing hearts, palpitations, heart feels like it's pounding. Some people feel very sweaty. Some feel really tired. Some people feel like they have trouble focusing or concentrating. They may get dry mouth or throat and feel like they can't swallow well. Some people have stomach aches or nausea, and then they don't want to eat. Some feel like a detachment from their self or their surroundings, and they feel almost frozen or immobile, like they can't move. And then other things like their color may look not great. They may say their vision is blurry. They feel kind of spaced out. And these are all normal responses to a trauma. So how do we help our teenagers? And as others have said, we really need to listen and listen to their retelling of the event and try not to interrupt too much. But again, at the end of their story, just like we do with younger kids, ask who came to help and how they became safe, or how everyone else became safe. Because you definitely want to end the story at a safe place. Be available, but respect their need for privacy. So yes, we don't want the door to slam in our face all the time, but they might just need some time to kind of decompress and not have us asking again and again, how are you? How are you? How are you? We give them, openings, and we'll talk about that a little bit more later about how to talk to different age kids. Again, reassure them that none of this was their fault. This, again, was an unfortunately ill person, but it was not their fault, and there was nothing they could have done to change the outcome. Definitely have them find friends or other adults that they feel like they could share their thoughts or their feelings with. It's not always easy to just talk to your mom or your dad. So maybe if there's an aunt or an uncle or an older cousin that they feel comfortable with, that might be somebody else good for them to kind of get their feelings out and not feel like they have to tell you everything. Definitely let your teen know that their feelings are important and they're real, and that they don't have to pretend like they're not feeling this. It's okay to feel sad or to feel angry or to feel isolated. But also help your teen think of ways that they can feel safe again. If they're feeling really unsure about their safety, give them opportunities to figure out ways that they can feel safe in the community. Be aware that some strong sounds, loud noises, smells, feelings, people, places may all be reminders. You may want to make a plan with your teen to help them cope with those reminders. So, if you're going to be going somewhere that's really loud, and that might remind them of the event that occurred, talk about it beforehand. Say, this isn't what happened, so it's going to be loud, but it isn't going to be what we had before, because this isn't what's happening again. As best as you can, try to keep rules and routines the same as Dr. Sirota said. We probably be a little bit more lenient and let them heal, let them sleep a little bit more, but provide regular dependable meals, regular routines, Let the house feel like a good, structured, safe place where people are available to them, but that we want to have our day go as our day should go, and that will also give them a feeling of security. Again, be aware of your own reactions and try to stay calm. It's very difficult sometimes to stay calm with a teenager that's not calm, but try to be supportive, be patient, and don't take what they're saying personally. They may, yell emotional things, but it's really not aimed at you. It's what they're feeling inside and aimed at what they've been through. But also maybe try to help your teen learn some self-regulation skills. Like, I know you're upset. Let's try to do some deep breathing. Let's try to relax. And maybe that'll help as well. Again, encourage return to fun activities and plan some future activities. We want everybody to feel some happiness at this point, even though we're all kind of grieving the situation. But it is important to have some joy in every day and help your child to learn that as well. Talk about ways that your teen can take control of safety and of the future. So maybe they get involved in an advocacy group or volunteer to help others recover. Help them feel like they can make a difference. Turn a negative into a positive change if possible, and try to capitalize on their strengths. So if your teenager is artistic, have them make posters. If your teen is a good writer, maybe they can write letters to their congressman in support of gun control. If your child is a good communicator, maybe they can do person-to-person work or volunteer to congressman's office or at our Lake County Legal Aid Clinic. There's a host of ways for teens and adults to volunteer under the Highland Park community sites. And, a good planner is great, could help with organizing a fundraiser. All things to make them feel good about their response to this terrible event and give them something to, not look forward to, but a future plan and a good use of their strengths. Again, healthy diet and exercise, super important. We know that these things help improve mood. They help you sleep at night. Try to enjoy meals together. A lot of times we are so busy that everybody's ordering in or door dashing everything or whatever, but try to have some meals together just as a way to reconnect, as well as do some fun things as a family. The only last thing I want to just bring up is, when should you look for more help? So if your teen's symptoms are lasting more than 4 to 6 weeks, that's a good time to speak with a therapist or to contact one of us. Certainly if they're not functioning in school or in other activities, if they have any bad body, complaints, severe headaches, stomach aches, really bad trouble sleeping, then you want to contact one of us first. And then we can kind of determine if we want to do a visit and see if there is anything going on. You certainly want to take your teen seriously and acknowledge the way they're feeling, and then we can see if there is something going on. Certainly, if they're withdrawing from family, especially if they're withdrawing from their friends, because we know friends are the most important. Certainly, if they seem extremely depressed or say anything about not having a future, that's an emergency call to one of us. If there's any reckless or harmful behavior, self-medicating with drugs or alcohol is a pretty serious thing, and we want to get on that right away, as well as becoming involved in some, what we would consider risky relationships. If your teen really can't get off thinking about what happened, if they're talking repeatedly about it, that's another reason to seek some help. And just know that we, all of us here at Pediatric are ready to assist.
Thank you. All right, now let's move on to some specific questions that have come in from parents over the last week and some that are coming in on the live chat tonight. We're going to rely heavily on answers from our 2 psychologists. They're obviously the mental health experts on our panel tonight, so I thank them in advance for their expertise. This first question is for Dr. Freedman. How do we respond when a child hears details from other children or adults that you did not expect them to learn?
It's a great question. So First of all, find out exactly what it is that they heard and what they understand about that, and then just really meet them where they're at. I mean, we can't completely control what they hear. You know, if your child is usually on the younger side and is going to be like, you know, they're having a play date with some other kids, it could be helpful just to talk with those parents, just to ask like what their children know versus what yours does. You can also kind of help prepare them based on maybe what that child may mention. But again, kind of just going back to earlier, you know, be honest, keep answers simple. You know, obviously, you know, we want to always try to control the narrative and try to, you know, we only want them to hear details of what we want them to know, but they're bound to hear other details at some point. And so just be prepared for that, and just be prepared to have an open conversation with them about it.
That's good advice. Dr. Gardner, we got several questions along the same lines, and here's two of them. The first one is, how do we help our children not feel anxious when they hear trigger sounds like loud noises, fireworks, sirens? And the second question, very similar, how do we help our children not to feel anxious or nervous simply when out in public and around crowds? What do you say to those parents?
Yes, absolutely. So I think the first thing to think about is being realistic about what we can expect regarding how kids may be responding and the anxiety they may feel, especially as recently as this traumatic event was. So I think rather than thinking about preventing or eliminating anxiety, we want to work on helping kids recognize anxiety and learn that they can manage anxiety in triggering situations. The best way to move past and cope with a traumatic or anxious event is to learn that you can resume your normal routines and get back to normal things, despite the fact that you may feel anxious about doing it. So I think just having sort of that realistic mindset going into it. But otherwise, I want to repeat some of the things that some of my colleagues have already mentioned on the webinar. I think, you know, a big thing to do is help to normalize kids' reactions, and especially those physiological reactions they might be having in response to some of those triggers. So, you know, you may notice that you seem a little bit jumpier when you hear certain sounds, or that your heart's racing, or that your legs are feeling shaky. So normalize some of that for them and help them understand that that's the way your body responds in certain situations to help to signal you about how you're feeling. It's a way that our body signals us to help protect us. Similarly to something Dr. Hochberg mentioned, we want to remind kids about the difference between the triggers they're experiencing after event and the event itself. We want to remind them that even though they're feeling scared and they're feeling some of those same physical feelings that they were during the event, right now the event is not happening. They are safe right now. So even though they're feeling scared, they are not in danger and they are safe. I think we also want to give kids choices, especially as we're, you know, thinking about them attending events that may involve fireworks or crowds. We want to give them choices. Yes, we do want them to return to their routines. Yes, we do want them to feel confident and safe. However, it may be giving them choices about what they attend, how long they attend for, if it's something like viewing fireworks or a parade, where are we going to sit, things like that. And then again, I want to repeat something that Dr. Hochberg mentioned as well. Have a coping plan in place, right? It is possible that your child may feel distressed when attending similar events. And we want them to have different choices about what they can do and how they can cope. So for example, maybe for younger children, getting a hug from a parent, having a parent hold their hand, doing some breathing exercises together, right? Just repeating some basic mantras about the fact that they are safe and they are supported. And then if it's something where you're not attending an event, but they may hear some of those triggering sounds, such as fireworks that may be occurring throughout the rest of the summer, if you know in advance that that's going to happen, maybe that's a good night to schedule a family sleepover or a family activity, so you can all be doing something together and doing something fun together in the event that your child may be inadvertently exposed to some of those triggers.
Thank you. What we don't say sometimes is just as important as what we do say. One parent writes in, please go over what not to say to help a child cope. Dr. Freedman, can you answer that one?
There's certainly a lot that we could we don't want to say. So first of all, don't lie. Right now more than ever, kids need not just want, but need to feel safe. And if you lie about anything, and it comes back around, that's just going to shatter any kind of trust and ultimately those feelings of safety. So honesty, but of course, in a developmentally appropriate way. We don't want to invalidate any feelings that a child or a teenager is having. They're allowed to have any feeling they want to, just like how we all as parents are as well. So don't invalidate their feelings. Don't tell them, oh, don't feel anxious. No, it's okay to feel anxious. I understand that you're feeling anxious. So really try to validate what they're feeling rather than invalidate. We a lot of not just kids and teens, but adults too, don't really want to go places yet. Don't push too much yet. We can always work down the road, after this initial period on getting them in, back to certain places that maybe they don't want to go, but don't force it right now. Meet them where they're at. Forcing it can really backfire. So just kind of let them take the lead. We want to avoid anything like get over it or move on. This is something we all will come out stronger for, and we all will, as a community, get through this together. But you don't want to, tell a kid, oh, it's time to move on, or why are you still thinking about that? Again, that just really invalidates their feelings, their thoughts, and everything that they've experienced. So if there's something you want to say to a kid and you're not sure, bounce it off somebody else, one of us or a friend or a family member, because it is important what you say. So talk to somebody else if you're worried about what you're going to say to that child.
Thank you. Yeah, Dr. Gardner, we got a couple of questions related to what you had just spoke about and also what Dr. Freedman had just addressed. There's a slight meaningful difference. One question, my child doesn't want to participate in our village's future parades for fear of being shot. I know the odds are small, but what do I say to make him feel safe? And here's the other question. How do we reassure grade school children it's safe to go to school, to go to the zoo, to go to a carnival, etc., without lying to them? So it's that last part that I'm curious about. I know Dr. Freedman had mentioned you don't want to lie, but how do you reassure them without lying to them?
Sure, absolutely. I think just regarding, I guess, the first question that was more specific regarding a child's comfort with attending future similar events, similarly to what I mentioned earlier, yes, I do encourage kids to resume normal routines and resume activities. However, being able to have choices regarding that or being able to gradually resume those things is also recommended and perfectly fine. I think regarding, those reassurances related to safety, it's a very tricky thing, right? There's no way for any of us to truly ensure that nothing scary will happen, that nothing traumatic will happen. It's a very difficult position to be in. And, parents and caregivers, their job is to, do their best to help kids be safe, but also allow them opportunities to grow and develop and engage with life. And so I do want to echo messages that Dr. Freedman has already shared about the importance of honesty, right? The importance of honesty and how that helps kids retain trust. We don't want to and shouldn't say absolutely nothing will happen, right? It will never happen again. We cannot, truthfully say those things. But I think we can talk with kids about the difference between a possibility and a probability of something happening, right? At this time, it feels like the events are happening very often and are happening a lot. We can talk to them about the fact that it is possible that something scary could happen, but that these events are generally unusual and they're not common. Similarly to how we were talking before in terms of reassuring kids, we can also remind them of the things that are being done to keep them safe and the people that are around that help them be safe. Especially if we're thinking about something like school, if you have any awareness of any of the safety procedures or protocols that are in place at your child's school, it would be fine to remind them, there are things your school does, such as, keeping the store locked or, whatever it may be, that is there to keep them safe.
Thank you. Dr. Freedman, this one is for you. Is it okay to use the words shooter and guns and death with kids under the age of 5?
So yeah, another great question. So yeah, I think part of you have to use a little bit of judgment based on knowing your child. Every kid may be a little bit different. I think try to use more kid-friendly language instead of like a shooter using like bad guys. I think guns and in terms of death itself, it's something that kids hear and they're starting at around age 5 to really kind of question a little bit more. So I think it's okay to use the word death. But I think guns and shooting, I would try to use a little bit more kid-friendly terms, just again, like bad guys or something like that.
Okay, thank you. Anxieties and fears may manifest themselves physically. This next question is for Dr. Sirota. My 10-year-old will not sleep in her own bed since the shooting and is scared to go near Highland Park. What should we do?
That's a very good question. And I think that's one that we hear very commonly. So I want to focus on the sleep disturbance part because I feel like we've answered a bit of the part about going places. Sleep disturbances are common with trauma. So there's no typical response to trauma. There is just no typical response, but having a sleep disturbance is a very common response in kids. And in fact, it may occur in 50% at least of kids who experience a trauma. So I think it's really important to be patient, be understanding, and allow your children time to heal. And so we have to have some realistic expectations about sleep. And this can be hard because especially at this age, these are kids where parents may have established very structured sleep and routines and really not be prepared for this. But sleep is when children are most vulnerable and they feel most vulnerable. Sleep is also a major separation for children. So it's common for separation fears to develop after a traumatic event like this, very understandably. And I think we also have to think about what the stress of the experience just physiologically does to sleep. Our stress response causes a hyper alertness and hyper arousal in us, and that quite obviously can contribute to trouble sleeping. And so we can see a whole host of responses. It could be the example in this question. It could be, which is not wanting to be alone, but it could be trouble falling asleep. It could be waking during the night and then having trouble falling back to sleep. And then, of course, nightmares or just distressing dreams can be very common with trauma. I think Dr. Hochberg touched on this a little bit with teens, but it can be common for victims, survivors to dream about the event. And that can be very frightening for kids at all ages. I do think, though, as healing begins in your child, and I think you'll know when that's happening as a parent, you can then start to set some reasonable but achievable sleep goals for your child and slowly progress back to the sleep structure that you had before. And of course, if you're trying to set these goals and your child is really not able to progress and it's feeling like something that's interfering more in time, that would be a great time to start to work with one of our therapists. And then there are some things that you can do right now that can be helpful with sleep. As I said, we have to understand, and we want parents to understand this is a very normal response. We should expect this. It's still important to maintain routine, and I know you're hearing this theme, but trying to maintain the usual sleep schedule is a good idea. And then, of course, just creating a very calm and safe space for sleeping. And so the trauma and the experience can make it very hard to feel calm enough to fall asleep. So one of the things you could even think about doing is starting to find an additional calming activity to add to whatever has been the bedtime routine for your child. And then that's something that could be continued over time as sleep starts to improve.
Thank you. I'm gonna go to a question that came up on the live chat tonight. And this one's for Dr. Freedman. How do you help validate feelings when kids may not understand what they are feeling?
Yeah, and that's a great question. So you can help them try to understand them, especially if they're younger kids and don't really understand them, based on what you're observing and your kid. You can be like, oh, it seems like you're feeling worried, or it seems like you're feeling angry. Try to really help label that for them. With kids, sometimes they, especially younger ones, they really express themselves through play and through art. And so through the play that they're doing, through the art that they're creating, you may be able to validate some of those feelings too. Also just physical validation as well, of just like, embracing and hugs will make them feel safe as well. But really just, this is a good opportunity to really try to help them understand better their own feelings.
Okay. This was a common question. I'm going to put this one to Dr. Gardner. What are the strategies to make my child comfortable going to counseling and accepting help after experiencing the mass shooting? Dr. Gardner, what do you suggest?
Absolutely. I like to start by just normalizing that a lot of kids and teens and adults feel hesitant about going to therapy. That usually happens for a variety of reasons. Some kids feel that it makes them different from other kids. Some kids just aren't even sure what to expect from therapy, or they feel uncomfortable talking about personal things with someone who's basically a stranger to them, or speaking about those things for the first time. So I just want to normalize that. But I think that as you see what your child is going through after the traumatic event, continue to normalize those challenges and talk about the importance of finding ways to help them feel better and get back to the things that they were used to doing. I think some reminders can be helpful. So I think reminding kids that therapy can be a short-term thing. It can be something where kids go for a brief time, they learn some coping strategies, and then they can help decide when they're ready to be done with therapy. I think reminding them too that therapy isn't just about talking about the event over and over again, because that can feel highly uncomfortable for some kids, but more about understanding their feelings, understanding their reactions, and most importantly, learning how to cope with it and learning how to move forward. One thing that I think can be helpful for some kids, and maybe even more so for teens, is finding their motivation to change, right? So if you've noticed maybe that they're more hesitant to go out, leave home, hang out with friends, maybe saying something like, I know you really enjoy spending time with your friends, but that you haven't wanted to go out as much or haven't wanted to be away from home. I wonder if through therapy, we could find some ways of helping you feel more comfortable with that. And then you could go hang out with your friends again. And then I think the last thing is parent modeling here is very important. So modeling as a parent the willingness to accept help, whether you yourself are going to attend therapy, or whether you say, I was going through a really hard time, or I'm going through a really hard time with this as well. And I talked to a friend, or, I talked to someone, and that was really helpful for me.
Thank you. It's all good advice. All right, here's a very specific but important question that I'm going to put to Dr. Freedman. How do we help children cope with their items that were left behind on the parade route?
Yeah, so I think really, I think it depends on obviously on the age of your child and the items that's left behind, but talk with your child about what they want to do with them. Have them have a say in it. Talk about, is it something maybe they just want to throw whatever that object is away. Maybe it's something they want to hold on to. Maybe that's something they want to donate. Maybe it's something they want to put in a box. Have them have a say in it. There's no one way to handle those different objects. I think it's just more give them that power and that choice to be able to say what they want to be able to do with those objects.
Okay. Dr. Gardner, this one's for you. If there were elementary school children at the July 4th shooting and they're not asking a lot of questions, should parents initiate a discussion about those events?
Yes, so I think we've touched on some points of this before, but we know that kids who may not be talking about something may still be processing it and thinking about it and feeling the effects of it. We also know that even if you haven't had a conversation at home, it's possible that they're hearing information from other people as well, right? From friends or family members or things like that. So I would say, yes, it is something, especially if they were present and they experienced the event firsthand, that you would want to talk with them about. You can use some of the advice that was given earlier about keeping things simple, keeping things basic, and answering questions. But if we don't bring up the conversation with them, it's possible that they're feeling effects that we're not aware of, or that they have some misconceptions or misinformation about what happened. And that would give us an opportunity to just correct that as well and make sure that they have an accurate understanding.
And as a follow-up, Dr. Freedman, anything for the preschool age group that would differ from what we just heard from Dr. Gardner?
I would agree with what she mentioned for that age, from what she was saying for the preschoolers as well.
Okay. Dr. Sirota, here's a very specific question, and unfortunately a sad commentary on life in America at this time. What is your opinion about bulletproof backpacks? Do you know if they're effective in the case of a school shooting?
So yes, a commentary, and actually this was something that I had not thought about before. And what I can tell you is you do not have to look far at all to find out about these. There are, options abound on Amazon. There are TikToks, there are YouTubes that promote these products. And I also want to say, though, that it's really understandable to me that this question would be asked, because in many ways, it's just a natural response to fear, right? When we have fear, we're feeling vulnerable and we want to do something to feel safer for ourselves, but as parents, especially for our children. And so what are the so-called bulletproof backpacks? As it turns out, they are backpacks that are either made or fabricated with there's ratings of armor, and it's a level 3A armor, which is also referred to as soft armor. So they're either built into the backpacks or they're actually like some inserts that can go into a backpack. And there's often actually, unfortunately, some indication that these are certified or tested by the National Institute of Justice. And it turns out that this is a false claim, that they only test body armor. And what's challenging about this, and I think really important for parents to know before they embark on thinking about purchasing these, is first of all, they're very heavy and difficult for children to carry, but they also do not protect against the kind of weapon we saw used in Highland Park, any kind of assault rifle. So that takes a level of protection that does not exist in these backpacks and only exists in sort of a heavy body armor. I think just in a practical sense, they don't protect the front, they don't protect the sides of children. If they're worn over the shoulder, like many teens wear their backpacks, then they're really not protecting any part of your child. I also think we have to think about the fact that in school, most of the time, kids are in situations where they do not have their backpacks on. They might be sitting in class, they don't have access to their backpacks. They're at recess, they're at lunch, they're in gym class. So it doesn't seem that it's something that would actually be accessible at the time of an emergency. And then I think, God forbid there were to be a situation, kids are going to run and those backpacks are heavy, and most likely in a panic, most kids would probably leave them behind to be able to move faster and easier. So I am only presenting my own opinion when I say, I don't think this is something that I would recommend, and I think there would just be more challenges than benefits to using them. But most importantly, I think the reason that I would not make a recommendation for this is because I think a lot about the emotional perspective in children. And I think that providing this for a child, and of course we have to be honest with kids, so they would have to know why their backpack was so heavy, that we would be reinforcing to them that their learning place isn't a safe place. And I would imagine that that would just increase anxiety and fear about being in school. And, you know, for those of you who are joining us in checkups, I always ask children about bullies, if they know what bullies are, if they've been bullied or experienced bullying in any way. And I always follow up that question by saying, we ask about that as pediatricians because it is so important for children to feel safe in school. They need to be safe to learn. And I just think that this would really go against a feeling of safety for kids. So my approach, I think, when it comes to safety in school would be that we focus our energy as pediatricians and parents on advocating, ensuring that our schools are safe spaces. And really the best way to do that is not change the backpacks, but to have very restricted access, right? Blocking access to school with security at key access points. So we also train children, and we can encourage them to follow the training they receive and the drills that they have in school as they get older. And in the case of younger kids, we should be reminding them that there are always grown-ups at school, and those are grown-ups who are there to help keep them safe.
Thank you. All right, here's one for Dr. Hochberg. One parent writes in, I usually try to keep my kids in the dark about tragic events. Is this wrong to do?
Well, it's not wrong, but I think, especially from what we've learned with this current situation, we shouldn't lie to our children. They will not trust us. So we don't usually recommend that the news is left on all day long at home, or that, again, that their social media feeds, we have to keep an eye on what our kids are looking at. But we wouldn't not tell them the truth about an event. I don't know that we have to go out of our way to discuss every detail of every event. I also don't think it's necessary to be incredibly specific about a lot of the news that's been coming out after this shooting, as far as, oh, you know, this one died this way, or this one, you know, this family is suffering because of you don't have to go into extreme details about all of these events. But on the other hand, we don't need to mask everything from our kids. Again, developmentally, if they're younger, it wouldn't be appropriate, as Shauna had mentioned, to bring something up, you know, with a younger child, unless they ask. But for older kids, if they're learning about it in school, you know, certainly school shootings they're going to hear about, unfortunately. The older kids are. So I wouldn't not tell the truth, but I don't think we need to have it be every dinner table conversation either.
Thank you. This next question is for Dr. Gardner. We all know the effects of this tragedy may not show up for quite some time. One parent asked, as time goes on, what signs of trauma should we look for?
Of course, and I think a lot of these have been reviewed as we were talking about the various age groups and how they respond, but I'm happy to just provide a more succinct list of things we can look for. Now, I think that we've already talked about disturbances in sleep, so having difficulty falling asleep, staying asleep, not wanting to sleep alone, potentially having nightmares. For some kids, they may exhibit regression in certain things. So maybe especially for younger kids who are toilet trained or, you know, eating a variety of foods or things like that, maybe they start to show regression. They start having some accidents or more pickiness or things like that. There can also be regressions in behavior, more acting out behavior. This could happen for younger kids, as well as Dr. Hochberg mentioned, for older teens as well, engaging in more risk-taking behavior, more acting out, more aggressive behavior. I think a variety of different emotions, feeling sad, angry, confused, afraid, being extra irritable or on edge. Some kids of all ages may have trouble separating from their parents. They may not want to go out as much or do as many activities or things they were doing before. The physical symptoms, headaches, stomach aches, feeling really tired, low energy. And then I think just those fears of reminders and wanting to avoid specific reminders of the event.
Thank you. This is an interesting question that came in. I'm going to send this one to Dr. Freedman. Now, one parent writes in, what guidance would you give to parents of multiple children? Do we talk with each child individually, talk to them as a group, and then individually? How do we do that?
It's going to depend on a few factors. One is going to depend on the ages of the kids. If the kids are 7 and 8, 9, okay, they're all relatively around the same age. You can talk to them together. But if you have a kid who's 2 and a kid who's 11, those are very different conversations to have. So I think it's okay, you know, again, depending on your child's age, your child's just personality and characteristics about themselves. You know, you can talk in general as a group and then kind of follow it more specifically. I've had this question a few times this week. So I think you know your kids, and I think can they all kind of, would it be good for them all to be together for cohesion and whatnot? Or is it gonna be better for them to understand and be able to process more on an individual level? So I would say it depends, but I would also do kind of a little bit of a mixture of it. If you're initially telling them, let's just say they were at overnight camp while this happened and are returning home, I would have that conversation more one-on-one, and then maybe all together, like as a family, kind of process it together.
Thank you. All right, this next question brings up an issue that's very important, so I want to make sure we get to it. The question is, how to cope with our children when I am also having a hard time with those events? That's obviously from a parent struggling to process this as well. What do you say to that parent, Dr. Gardner?
Absolutely. I really want to normalize that as well. What a difficult, you know, situation to be in when you're experiencing very similar, you know, emotions and reactions to your child. I think absolutely before you're engaging in conversations with them or offering support, you want to check in with yourself and see, how are you feeling? How are you doing? And what do you need? As we were talking about before, as I talked about before, when we were talking about counseling, you know, whether it be more formal therapy and counseling or just needing support from extended family, friends, etc., being able to check in with your support network. I think continuing to maintain your own self-care, your own routines, right? Of course, as much as possible, take care of yourself, go for walks, you know, drink enough water, all of those things that may feel very basic, but may go, you know, to the wayside when you're managing so many things and trying to support your child as well. And then before you do have that conversation with your child, just ensure that you feel ready to talk about it. Of course, it's okay to model appropriate emotions for your child, that you're also feeling sad or scared or confused or angry. We want to make sure that you are able to do that appropriately and, you know, maintain composure and things like that when you're having that conversation.
Thank you. All right, we're going to have one last question here for Dr. Hochberg.
Could I just interrupt and add one thing?
Sure.
We have had some excellent services provided in the community in Highland Park, and I just want to put a plug in for parents, just to the point of the last question Dr. Gardner answered, that the services at the high school, my understanding is that they've been extended this week, and you can access that information on the City of Highland Park website. And those are outstanding services for parents, for children, for individuals who were victims and survivors that were at the parade, for those who live in the community and have been experiencing the trauma as well. So I just want to add that there's a great opportunity additionally in the community.
Thank you. As I mentioned at the beginning of the webinar, the Highland Park Office of Pediatric Partners sustained some damage from the bullets fired by the gunman along the parade route last week. So Dr. Hochberg, can you give us any details on when the Highland Park Office of Pediatric Partners will be opening?
Absolutely. So As our patients, most of them know, we never closed. So we were fortunate enough to have our Vernon Hills location, as well as so grateful to the staff and physicians at Highland Park Pediatrics on Park Avenue West for allowing us to use their space so that we always can be available to our patients. The office, as of today, got a very thorough cleaning and is going to be scrubbed up new. We are anticipating or hoping that glass gets delivered by the end of next week, and really getting prepared to open hopefully within the next 2 weeks. So while we are still here, we're just down the street in Highland Park and in our usual Vernon Hills location. We hope that our regular Central Avenue location will be open once again within the next couple of weeks.
That's great news. Thank you. All right, we're going to finish our questions for the night, and I want to thank all of our panelists for being here tonight. Dr. Freedman, Dr. Gardner, Dr. Sirota, and Dr. Hochberg. Thank you all. I want to thank all the registrants who attended. And for a final thought before we adjourn for the evening, I'd like to turn it over to Dr. Sirota.
Yeah, I think to end, first of all, thank you everyone for your time, and to my colleagues on this webinar for contributing so much important information. But on a positive note, I think it's so important that we remember that resilience is this wonderful thing that we all have in us. We all have it, and we might not feel it right now, but in time we can build on this, and we can help our children build on theirs. And resilience is what's going to give us, and will give your children and our whole community, the capacity to cope, to endure in these difficult circumstances, but then move forward. And today I had an opportunity to hear a really brilliant trauma psychologist speak and give some very good advice. So I just want to share that. These are not my own words, but what she said is that she tells her patients, make this a story in our lives, but not the story of our lives. And I thought that was very, very helpful advice for all of us.
Wow,
So thank you.
Thanks, Susan. A good thought to part with. So again, thanks to everyone. And as a reminder, we'll be sending out an email to everybody how you can access the recording of this webinar in the next few days. Thanks again. Good night.